Hello everybody, this is Dr. Gita Mathai and this is my Health Vibes channel. Today we are going to talk about osteoarthritis. If you look at the population of India, what used to be a young population is now aging. There are a lot of people over the age of 50 and many of them complain of pain in the hips and pain in the knees and pain in other joints of the body. Now, the reason is that over a lifetime, the hips and the knees have to bear the weight of the body, and this means that the bones can degenerate. When they degenerate, they can cause pain. The hip and the knee joints have one bone articulating with another bone. The surface is covered with synovium, and there is a cushion called the cartilage between the two bones to prevent them from rubbing against each other. As the person gets older, the cartilage degenerates, and then the bones begin to rub against each other here and there. This means that there is tension on the nerves and there is severe pain. The pain is aggravated when the person gets up, stands up, walks, tries to move, and it is relieved by rest. So the person tries to take more and more rest and is very upset about this pain. But what happens is when there are muscles which support the joints. So if you don't exercise your muscles and you take a lot of rest, the muscles become weak and then the joints and the bones rub against each other even more and the pain is aggravated. So what happens? More rest, more pain, more rest, more degeneration. Why does osteoarthritis occur? It occurs in almost everybody to some extent, but it is likely to be severe and aggravated if you are over the age of 50 years, if you have a family history of osteoarthritis, if you've been in an accident or had some other injury to the joint, or if there is a congenital deformity of the joint. How is osteoarthritis diagnosed? First, you need to have a complete physical examination. When the doctor examines the joint, there is some restriction of movement. There may be some sounds like crepitus on moving the joint. An X-ray or a scan will reveal the degeneration. Sometimes when the bones degenerate and they rub against each other, extra bones called spurs are formed, and these cause more deformity in the joint and more pain. Now, how do you treat this? Nowadays, we live in an age where everybody wants instant relief. But in osteoarthritis, you are not going to get instant relief. First of all, you must try yourself. Apply a capsicum containing ointment on the painful joint and then apply ice. Do this every 2 hours. If the pain has been present for some time, more than 2 months, then ice will not relieve the pain. Apply warmth or heat. Try immobilizing the joint to prevent the bones from grating against each other. These caps and sleeves are available even online. Don't be ashamed to use a stick. The stick will take part of the weight and so less weight will be on the joints. Do exercises to strengthen the muscles over the joints so that the muscles hold the joints in place. You can contact a physiotherapist and learn the exercises. You can go for yoga classes or you can try to do them online. Once you go to a surgeon and he might give you tablets, usually paracetamol is what they start with. If that does not relieve the pain, then ibuprofen. If that does not relieve the pain, stronger and stronger analgesics are used. Remember, analgesics all have side effects, so after a certain point of time, some other method has to be tried. Sometimes they inject a jelly into the joint so that there is lubrication, or surgery may be done to fuse the joint or remove any extra spurs or loose parts which are there in the joint. But people want an instant relief, and what looks like instant relief is surgery. Oh, you think I will replace this faulty joint with a ceramic, plastic or metal joint and then I will be fine. You may be fine, but remember that it is a surgical procedure, it is a major procedure. The new joint that they put in can get infected, blood clots can occur, and the weight bearing may not be good so that your gait becomes irregular and other joints begin to pain because you are no longer putting equal amount of weight on the two legs. There must be physiotherapy before the surgery and after so that your muscles are strengthened and are able to bear the new joint. It will take almost 2 months for you to get back to your normal state. remember, surgery is a last resort, and don't try and have surgery immediately saying, I want immediate relief like an OTP. Thank you. This is Dr. Gita Mathai signing off. This is my Health Vibes channel. If you liked what you heard, please subscribe to my channel and press the bell button. The same content is available in Tamil. Thank you.